I know. Dr. Mehmet is a plastic surgeon who specializes in BBL procedures. This model is one of the most in-demand procedures in aesthetic surgery. He offers his patients not just an operation, but a transformation at a luxury level. Dr. Mehmet Veli, how do you make beautiful women unforgettable?
Yeah, that's a good question. No woman is ever forgotten. How could they be forgotten? They are the source of our lives. But of course, people always say that outer beauty isn't important. It's always inner beauty that matters. But unfortunately, that's not always how it goes. When people look in the mirror, that thing we call self-esteem, I think their self-confidence really drops. We also contribute to that. If that self-esteem, every woman has it, because every woman is actually beautiful. If we help enhance that beauty, it becomes an unforgettable beauty.
Thank you.
And I think that's the most important thing about plastic surgery. In other words, helping people regain their self-esteem and confidence.
Thank you. Beauty really is a great power, of course.
Okay, I have a question like this. What is the difference between BBL and implants?
That's a very important question. Now, actually, the goal of both is the same, but there's a big difference between them. The difference here is really about the concept and philosophy. For example, there's an American philosophy, but its origin is actually the Brazilian, South American philosophy. That's why it's called BBL, Brazilian butt lift, because the point there isn't just to shape the butt. Actually, it's about shaping the whole body from a South Latin perspective. But I actually researched its origins. The fundamental origin is Africa, let's not forget that. And having a beautiful or shapely butt, and in some cultures a large one, is a symbol of motherhood, a maternity sign. So, it's because of an instinctive feeling inside us. In other words, from the male perspective, there's an anthropological aspect to this too. The fact that women have a larger pelvis and butt structure symbolizes fertility, and that's actually where this comes from. That whole instinct and drive comes from there. But of course, in Latin America, this became very popular, because it was almost a must-have requirement there. Then it spread to the rest of the world. And of course, I've performed thousands of surgeries on this topic. When it comes to butt implants, though, there are technical differences. In one, we use the patient's own fat to enlarge the buttocks, and in the other, we use an implant. Just like with breast implants, sometimes it's necessary to combine both methods, because sometimes the shape of the butt can't be achieved with just fat. That's because the butt consists of bone, muscle, fat tissue, and connective tissues. The only thing we can't change is the bone. We can change the others. That's why they're two different surgeries. But sometimes you need to do both together, and sometimes separately.
Doctor, how is the fat collected for the BBL procedure?
That's a very important question. Now, there are actually different methods, and some of our colleagues collect the fat in different ways. But we've developed a protocol. Did you know about this? The Fat Safety Transfer Protocol. Our goal here is to perform this fat transfer in the safest way possible for the patient. This is very important. Actually, there are technical details involved. Absolutely all the equipment used to collect the fat stays inside the operating room and on the table, not outside, and the same goes for when we inject it. It's a closed-loop system. The tissue never comes out. This keeps us in a very safe position. The risk of infection, the death of the cells, because if you take it out, centrifuge it, and then bring it back, there could be issues at every stage. Any of those steps could cause a problem. Our tubing systems, because we collect them in special sterilized bottles like this. That entire tubing system is checked, and before the procedure, it is always washed again. even if it's sterile. Because in our studies, we've found that there can even be particles present. That's why we make sure everything is absolutely safe, and that's how we collect the fat. But that's a very important question. Thank you for this.
How much fat is needed for a good result?
That's a tough question too. It's a good question. Now, the amount of fat here isn't what matters. The person's body structure is very important. Because for some people, 500 cubic centimeters is enough, for others 300 cubic centimeters, but for some, it takes as much as 1,500 cubic centimeters. Of course, this depends on height, body type, bone structure, and pelvis shape. And there are also different buttock types. Each of these has its own unique dynamics, so what matters here is not the amount, but applying the right amount to the right patient.
All right. Thank you very much for answering the questions we were curious about.
Thank you.
If you have any questions, please feel free to write to us. We are always happy to help.